I'm with Ann-Marie DePalma, who is the author of the From the Podium column in RDH magazine. Ann-Marie writes about continuing education seminars that are presented for the dental hygiene profession, as well as the presenters themselves. How are you, Ann-Marie?
Doing well, Mark. Thanks for having me here.
Well, thanks for joining us. Has the economy affected continuing education in dentistry? The hours for relicensure are still required, but have less expensive options for continuing education gained any popularity.
Definitely. In terms of people not wanting to travel, the costs and time involved in travel, so people don't want to take time off from work. They're sensitive about losing their jobs in the tight economy. So it's difficult for people to go to traditional in-class on right in person courses. So all sorts of other types of things have come about. There are programs like what Penwell has in the I Need CE online courses where you can read the information and then pass a test, or you can do online courses through a number of other opportunities that are out there.
Well, I've often heard the statement that face-to-face learning gained from a seminar is the most effective method of continuing education. Do you think that online methods such as webinars have been successful in reproducing the quality of the learning environment that live seminars have?
There will never be a total replacement for live seminars. We always need those. It's the camaraderie that we gain when we meet one another and share ideas and all of that. But the online side, whether that be synchronous, where you're face to face, one on one at the same time, or asynchronous, which is, you're sitting at a computer in the middle of the night watching or listening to a webinar that has previously taken place, is something that is now advanced by our technology. But it's just another avenue for us to educate ourselves as dental professionals.
A lot of and you're very young as I am, so I know that a lot of dental hygiene students have gone through this education process using the electronic blackboards where professors were sometimes teaching a course at a distance. So do you think the online application will be more beneficial to the younger dental professional?
The younger people tend to gravitate more to technology, but us seasoned professionals, hey, it's great. I achieved my master's degree through an online course, so it was wonderful. I took it during the evenings after work, or did seminars on the weekends. It just worked great for me whenever I had the availability to do it. So even as a seasoned professional, it was wonderful for me and gave me the opportunity to get a degree that I would not have been able to if I had to go face to face. So in terms of continuing education, yes, that's also an avenue for people, seasoned or new professionals, to gain more education. As our profession grows, we need more and more education. So it's something that I think we'll see more and more of, and it will grow across all ages.
Okay. Well, you're writing about the RDH Under One Roof Conference in your July 2011 column for the magazine. UR is often called as the Penwell Conference, and Penwell is the publisher of RDH. But so I want to kind of eliminate that from the discussion because I know there's a vested interest in me, for me to bring it up with you. But let's just say that if a dental hygienist has never been to a dental conference beyond the local or state meeting, which conferences would you recommend to the dental hygienist other than UR?
ADHA, the annual session of ADHA. There are a number of large dental meetings that are changing slowly over time to incorporate more dental hygiene courses in them. I'm in Boston, so we always have the Yankee Dental. We also have, the Greater New York or the Chicago meetings. So those are more geared towards dental professionals, but they are also including dental hygiene and all the other professions within dentistry. However, the associations, the local associations, Massachusetts has an annual convention every year in September, so we do promote that. Going to your state dental hygiene or local components, they always have such great opportunities for hygienists, and naturally ADHA and Under One Roof.
You mentioned the larger meetings that are organized by dental associations, such as the Chicago Midwinter, the Yankee Dental, the Greater New York. How do you feel like? Do you feel like hygienists get the most out of those meetings when they go to them? Is there a strategy that they should be using? Because hygiene is not necessarily the primary focus of those meetings for obvious reasons. So, do you have any suggestions for developing a strategy as far as getting the most out of those meetings?
Years ago, it used to be you'd go up and down the aisles and you'd get free samples on the exhibit floors. Now, companies are more reticent to do that. They don't give out as much. But what you should do when you go to those meetings is go to the specific sponsors of companies that promote dental hygiene, the ones that are out there and bringing dental hygiene more out into the forefront, being supporters of it in whatever manner, shape, or form, be that providing new products for dental hygienists, loops, chairs, ergonomic issues, or those that just promote dental hygiene by promoting speakers or promotions or all sorts of things like that that have a vested interest. Make your face and your name known that you are a hygienist and that you support those companies, as well as looking at the overall program and trying to find which courses would benefit you as a hygienist, and clinical as well as overall in total practice management, so to speak. We're not just doing clinical hygiene anymore. We don't just sit in our little operatory and do scaling and polishing. There's so much more now that we can do as hygienists, not only in the realm of the oral systemic connection, but also in other areas of the practice.
Okay, and you also were referring to the ADHA. The American Dental Hygienists Association has changed the format of its meeting in recent years. Do you have any comment about some of the good things that they're doing with their program?
They're bringing in all sorts of continuing education programs to make it more open and more dynamic for all hygienists, not just those that are involved in the political side of ADHA. They want to bring and mentor the younger hygienists. So bringing continuing education into their side, into their program is great as well.
And of course, I just mentioned a moment ago that I work for the company that produces RDH under one roof. So you're not obligated to give your compliment, but do you think there was any benefit for hygienists to go to your?
Definitely. I've attended a number of them over the course of the years, and Under One Roof is an exceptional meeting. Penwell, as a biased side here, Penwell does an exceptional job of bringing hygienists in and making even the newest person coming to Under One Roof. A lot of people come by themselves for the first time. So they're, oh, what do I do? Where do I go? But Penwell makes it more comfortable for them, and the courses and the sponsors and the exhibitors are all wonderful.
Well, Ann-Marie, thank you very much for your time. Ann-Marie, again, is the author of the From the Podium column in RDH, and I guess your June column will be appearing on the street soon. So, thank you.
Thank you, Mark, and have a great day, everyone.